So good morning, everybody. My name is Jacky Guerrero. I'm an Associate Director here with the Equity and Community Investments team with the Advancement Project. Thank you so much for joining us today as we launch the Justice Equity Service Index. It is an interactive tool locating and examining LA County's justice-related system of care. And we have a pretty great lineup for y'all this morning that will take us to noon. So of course, feel free to stick around with us and to hear more about what we have in store. You can take us to the next slide, please, Daniel. The previous slide, 1 second. So again, drop in your name, the organization you're with, and where you're joining us from. That would be fantastic. Just a reminder, we are going to be recording this presentation, and we will share the recording in addition to the links and the slide deck for folks afterwards, so no need to worry about that. We can go to the next slide, please. And just another reminder is we'll be using the QA function, the chat function, to be able to answer any questions that we may not get to in the webinar itself. Because we have an hour this morning, again, we may not be able to get through everything in the questions. So we'll do our best, and if not, we'll certainly follow up in the email that goes out afterwards. So again, thank you so much for joining us. The purpose of today's webinar really is for us to be able to explain to you what the Justice Equity Service Index is, the methods we use to develop the tool. We also hope to walk you through how to use the interactive in your own examination of what the community-based system of care is here in LA County. And you'll also hear from policy experts and advocates who are involved in building out that community system of care, individuals who are very central to that process. So again, thank you so much for joining us this morning. We also have actually, if you don't mind taking us back for 1 second, Daniel, before I kind of walk folks through the speakers that we have and that you'll hear from this morning, I definitely want to say and underline how grateful we are for the many justice advocates and service providers who generously lent their invaluable wisdom to help us build this tool. Their participations and insights made this tool very meaningful. It certainly helped us improve it. So we just want to be, ensure that immense gratitude that we have, for those that were able to participate in the focus groups who helped us hone this tool. Thank you, Daniel. If you don't mind taking us to the next slide. So now I want to just briefly walk you through the slate of speakers that we have. We're going to hear from our fearless leader, John Kim, the Executive Director of the Advancement Project, who's going to, kind of set the stage, if you will, and ground us in the moment that we're in right now. Then we'll hear from our colleagues, Elycia and Mulholland Graves, who's with our research and data analysis team, who will walk us through the tool. And we'll also hear from Daniel Wherley with the Equity and Community Investments team, who will really kind of help us understand how we can use this tool, what it does and what it doesn't do yet. And of course, you know me already. And then we'll also hear from our great guest, Judge Songhai Armstead, who's the Executive Director of the Alternatives to Incarceration Initiative with LA County, and Mr. Yusef-Andrew Wiley, the Executive Director of Timelist Group, a reentry service provider here in LA. So they have, really important messages to share with you all. So again, we're very grateful to have them join us this morning. So now, just to kind of get us started, I want to pass it over to our fearless leader, John Kim, who can really set the stage and really think of, ground us in the moment that we're in with the county. Pass it over to you, John.
Thank you so much, Jacky, for your leadership and getting us all here today. So we are in an interesting moment around criminal justice reform in LA County. The preliminary ruling by Judge Strobel on the future of Measure J is a big deal. Though to be clear, we see this potential ruling as being indicative, but certainly not definitive. It's indicative of the contradictions and the push and pull between the old and the new, the magnetic pull of the status quo and the pull now of what justice really demands of this county. But it will certainly not be definitive, as other courts and many, many other voices will have their say before it's all over. So in a moment like this, our job is to keep it moving. It is also in these critical and tumultuous moments that we, as a collective, need to take a step back and see the journey, the larger journey, for what it is. LA County was formally established as a jurisdiction 170 years ago in 1850. Its founding design, and we should be clear about this, its primary function was to extract resources found and imported and to move the value into the hands of the very few and the very powerful. And for much of its 170-year history as a jurisdiction, it's perfected how to invisibilize and brutalize Black, Indigenous, and other people of color. And it unfortunately got so good at this strategy that it eventually created one of the largest county incarceration systems in the world. 170 years is a powerful legacy to contend with. And it's the hard road. It's been a hard road to even start turning the tide on what the criminal justice system has meant in LA County. 170 years is a powerful legacy to contend with, and we should be clear that it was only by the power and the strength of organizers and activists on the ground that got us to this particular point. 170 years is a powerful legacy to contend with, and we need to be realistic about the work that's required moving forward, and what it may take. It may take years, even decades, to finally get the system that we want, and that it's just not about tearing down the old, but thoughtfully crafting, intentionally building out what the new will look like. And that's what today's conversation is about. Whatever confusion there may be in the courts at this moment, the voters of LA County are very clear about their values when it comes to criminal justice in this county. Not just about how they voted on Measure J, but who they have consistently voted into office to lead this county. But values alone will not get us to the system we seek. We will need to build the tools and to be smart about how to deploy limited resources to prove the idea that a care-force county can indeed work and that another system is possible. So we built the Justice Equity Need Index, known as the JENI, with our community partners, folks at the Community Coalition and LA Voice and several others. We built that several years ago in anticipation of this moment, and we're happy to see its usefulness in the conversations around the ATI and Measure J. But today we're releasing its sister component, the Justice Equity Service Index, something that was in fact much more difficult to build, but something that we also hope will prove its worth in this effort, because in the end, we will need eyes to see where the needs are greatest and what assets we have currently to build upon, to invest in, to build out this new care and service infrastructure. We need to respect the amazing on-the-ground providers that have been doing this work and to make sure that they're properly resourced and to build around them in the highest need communities. Because in the end, we will not win if we fly blind when it comes to this. If we don't see each other and we don't always stay focused on what's most important in terms of the system that we build. So today's release, we are hoping, will contribute just one more tool to this sort of necessary conversation moving forward. And it's critical at a moment like this for a conversation to move away from political posturing and into the nitty-gritty of getting stuff done and fulfilling the true promise of this county for the next 170 years. So with that, let me go ahead and pass it back to Jacky to go ahead and move us forward. Thank you so much.
Thank you, John, for those really great words, and also just a really great reminder that the system that we have right now, this carceral system, has taken, has been in place for hundreds of years. It is going to take a very systematic and community engaged process to be able to dismantle and move us away towards that care first vision. And with that in mind, this is why we're super excited to have Mr. Yusef-Andrew Wiley join us this morning, who's a service provider here in LA, but has really worked across the state to build out that system of care. Before I pass it to Mr. Wiley, I want to read his bio that he shared with us, so you can, the folks listening can get to know him a little bit better. and hear his story. So Yusef Wiley was born and raised in South Los Angeles, California. Both of his parents are originally from the state of Texas. By the age of 13, he started associating with gang members and getting into trouble around the neighborhood. After serving a juvenile sentence, Mr. Wiley continued his gang involvement with other known gang members and earning a reputation as a gang banger in the areas of South LA, Compton, Watts, and Willowbrook, which eventually landed him in the correctional system at the age of 21. After being placed in solitary confinement, Mr. Wiley began to discover his spirituality and later converted to Islam. It was his spiritual faith that took him away from a lifestyle of gangs, and he served 22 years before he was released in May of 2012 at the age of 43. Since then, Mr. Wiley has been working for many years to end gang and youth violence through his development and writing, intervention, and rehabilitation programs. He is a creator and founder of Timelist Group, a pre-release, post-release rehabilitation program, which also provides housing for parolees in LA and continues providing trainings at several correctional facilities. He's also assisted several reentry startup organizations in the Bay Area, was a former commissioner on the Human Relations Commission of the City of Union City, Alameda County Reentry Panels and Advisory Board. He's an author and has gained his AA degree in small business management, as well as a paralegal degree, and is a certified trainer and personal coach of the John Maxwell team. He's currently the CEO of Timelist Group, a lead consultant and a reentry expert. So again, we're very, very grateful to have Mr. Yusef Wiley to join us today, who can speak more about the impact that his work has, really underlying the critical need for individuals who have been system impacted to be involved in the delivery of those services. And then again, the need for capacity building for more providers to be able to be part of that care first vision and planning out, right? So I'll pass it over to you, Mr. Wiley.
Thank you, Jacky. And I truly appreciate the Advancement Project California, the team there doing awesome work. Yeah, I just want to jump right into it. Just this week alone, the amount of providers that reach out to myself and my VP, Cortez Chandler, just asking us, Yusef, how did you get your program going? How did you begin to do housing in South LA? And they're trying to figure it out. A lot of providers are out there trying to figure out how to do this work with support from the county, and they're not able to do it. I come from an area, as was read in my bio, where to this day, every time I visit my parents' home, I'm seeing a lack of service. I'm seeing a lack of, hope. People are literally hopeless. And, when you walk outside in your front yard or you walk down the street, I'm talking about streets that, the same buildings, the same ran down buildings, the same lack of service, the same lack of presence of service in the community that I was born and raised in, which a lot has to do with my thinking and develop my thinking because of the lack of infrastructure, the lack of service in my community, which led me down that path of gang involvement. So when I talk to these providers and they're asking me how to do this, and I, you're just knowing people. It's not about knowing people, how I got there, but about really looking at the service index, looking at the work that is happening right now with the Advancement Project. And when I think about it, it's like, it doesn't make sense to have this amount of people on the ground looking for support from the county, but doing it out of their kitchen, doing it out of their garage, doing it out of their local church. They're trying to make do. And this is what we're doing right now in this community, is we're trying to find a way to get people connected to the government resources, to those funding resources that can help them advance their work. And when I tell them about some of the requirements that they have to go through to even get funded, they like, I can't do it. I mean, I literally can't do it. And and a good example of that would be like how they may look for audited financials and things like that. They want you to be in business 3 years, and all of these different barriers that organizations have to go through to even get funded. How do they even get there? How do they even start if you're not giving them a chance, if the county is not giving them a chance, right? And you go in these communities and they haven't stopped. See, this is how you know that the people have a heart for the work. They have a heart for the work because they're there. They're still there. They're still doing it without the resources. So why shouldn't they be getting funded? Why shouldn't they be supported, right? By Measure J, by these other funding streams that exist out there. They're totally neglected. Look at the Antelope Valley, for example. This is like the forgotten area of LA County, right? Same response. They reach out to me looking for support, looking for help, how they can advance their work. I just learned about a recent project in LA, PCI, People Community Improvement. They had a space and everything, a space that was keeping children off the street, keeping young teenagers and middle school age kids off the street, somewhere that they could go after school with access to computer lab, where they can do homework with tutors, but they wasn't funded. And oftentimes it's a result of not necessarily having the desire to go after funding, but the fact that they need the capacity. A lot of people just don't know how. They just don't know how to get funded, right? So they need that support. They need capacity building to get that support. I take a page from Alameda County. There was a time when Timelist Group, we wasn't funded either, but Alameda County had a capacity building fund that helped us get funding. No questions asked. They gave us $5,000 just off the top, just a one pager. We filled out a one pager and everybody got that $5,000. I don't think we realized the impact that would have when you give out $5,000 to a community-based organization that's been struggling to survive in their community, to serve their people, and you just hand them $5,000. Of course, they're going to follow the steps and the stages to do better. Of course, they're going to go through the process of building their capacity because you showed your interest. You've given them hope that they can do this work with the support of these agencies. So having something like this advancement project, the system of care index is like what I like calling it, is going to help this county. It's going to help us. It's going to help us as a country, I believe, if we're using it. So I truly appreciate having something like this. And I want to let you all know that however I can support it, I'm there, our organization is there, and it's going to be massive if we begin to use this tool to advance this work. Thank you.
Yeah. Thank you, Mr. Wiley, and just thank you so much for your words and sharing your story. Again, these tools that we're developing are just that initial stage, right? It's always that partnership with folks like you and other community-based organizations that are going to get us to that transformation that we're seeking. And so very grateful for your presence today, this morning. And also just a reminder for folks who are joining us, if you're interested in getting in touch with Mr. Wiley and other folks who are going to be speaking today, we'll be sharing the emails out as well so you can get in touch with them. Because everybody has really great ideas and messages that we want to make sure that folks, if you're interested, can follow up with. So again, very grateful. Now, Daniel, and folks, everybody, I want to get us to the heart of the presentation this morning, or the webinar, which is now, we want to be able to show you the Justice Equity Service Index. And for that, we're going to hear from our colleague, Daniel Wherley, who will be talking about the purpose of this tool, the applicable uses, and then Elycia Mulholland-Graves, who will walk you through the data talk about the data methodology that we used. We'll walk you through the interactive tool, and then again, guidance for how to interpret this information. And if we have time afterwards, we'll like to take a question or two. at the end in case it comes up. If not, we'll try to get to it again after the presentation. So let me kick it over to Daniel, who will get us started.
Thank you very much, Jacky. As Jacky's been saying, and I want to make clear, is every tool has its purpose, and JESI's was clear pretty early on. It was to fill the gaps, preventing a fuller understanding of LA County's justice-related service landscape. So we designed this tool to work in tandem with the JENI to help guide advocates and policymakers as they make the critical decisions necessary to build up a care-first county. To develop the JESI, we first examined the full scope of services available in LA County. We did that by utilizing providers' self-reported IRS codes. We then took that list and winnowed and refined it, assisted by our service experts focus groups with folks like Mr. Wiley and others, to arrive at 4 overarching justice-related service components that are aligned with the county's care-first approach. My colleague Elycia will share those with you in a moment. Overall, it can't be overstated that this tool was only possible because of the ongoing partnership with community-based leaders. Their experience, expertise, and insights shaped the JESI, everything from uplifting the most critical service types to suggestions on how the tool can assist as the county begins implementing strategic capacity building. So not only are we grateful for this collaboration, but it once again demonstrates that continually tapping this deep well of local knowledge and centering the community voice in decision-making is absolutely critical to both the JESI and the county reaching their full potential. But while it is a vital step forward, the JESI can do a great deal, it's also important to point out what it isn't and doesn't do. This tool does pinpoint community-based service providers and lends insights on their income and assets, but it doesn't include those services that are provided directly by the county, nor does it track the specific funding coming via county contracts. All valuable information, but it does not track that at this time. As IRS data only lists providers' primary function, the JESI doesn't capture individual providers' entire scope of work, nor does their fixed address reflect their service coverage area. While quality is integral to impact, JESI isn't able to assess the quality of these services at this time, just that a certain type of service is delivered. And lastly, the JESI is a point-in-time advocacy and planning tool. It's not a referral tool that can track service availability in real time, like the county's service and bed availability tool. While those are valuable tools and hopefully complementary to the JESI, they are not overlapping. Keep in mind though, with all those being said, over the years in multiple versions, the JENI, the earlier version, the Justice Equity Needs Index, has evolved to meet the changing needs and available data resources in our county. No doubt the JESI will similarly evolve over time as the county evolves towards this care first vision. As it stands today, the JESI can help us a great deal, and my colleague Elycia will now demonstrate all of that. Thank you.
Thank you, Daniel. So as Daniel mentioned, we worked with our community-based providers as well as county experts to come up with 4 core components in the JESI. So this visual shows what those 4 service components are. They include health and wellness, which includes behavioral health and physical health and well-being services, housing and employment, which includes housing and shelter and employment and career training services, prevention and intervention, which includes prevention and reentry, as well as youth development services. And then our 4th component, community services and advocacy. And this one includes human services, as well as advocacy and community action services. Before getting into our data methodology, we just wanted you to understand this overall framework for the JESI and the idea that the JESI includes an overall index score, so the Justice Equity Services Index score, as well as a score for each one of these components at the zip code level. Next slide, please. So as Daniel mentioned, we relied on data from the IRS. So this is data from the IRS on exempt organizations throughout the county. This data source forms the core of what the JESI is. We use the information in this data source to select organizations to include based on their primary activity and to scale the JESI by the size of those organizations, their income as well. So the very first step in the JESI is taking this IRS list of organizations and narrowing it down to our list of organizations based on what we identified as justice related or care first with our partners. Next slide. So this slide summarizes how we get to our component scores and final JESI score. We didn't want the JESI to be pure counts of organizations, as that wouldn't capture the scale of organizations at their size relative to the population and zip codes. So each component is based on the raw count of organizations in the zip code, the size of those organizations based on 4 categories of income. Larger organizations are given more weight, and then the population of the zip code. The final JESI is essentially the average of the 4 component scores. Great, so I know you're eager to get to the data, and we're about to do that, but before we do that, we do want to make sure that we're providing you some guidance on how you can use the JESI and interpret the JESI on your own. So we intentionally include information on the Justice Equity Need Index with the JESI. So you can not only look at service levels in a community, but also the level of need. So it's important to interpret the JESI alongside the JENI. So high service levels do not always translate to no need for greater capacity. A zip code high on the JENI, the Justice Equity Need Index, may have a high service level, but still struggle to have enough capacity to meet that greater need in their community. And then low service levels do not always translate to a need for greater capacity. So a zip code with a low service level may look like it needs additional services, but what if that zip code is also a low justice equity need zip code? Perhaps the service level is the right size for that level of need. And some look at the JENI and the JESI together and look specifically for clusters of areas that are cold spots or low in services, but hot spots or high in need. And lastly, as mentioned by Daniel, just keep in mind some of the limitations of the IRS data when you're looking at the JESI. And this slide just brings together everything I mentioned before, as well as layering and the importance of what we've said of layering in community input and insights. So we encourage you to consider the JENI and the JESI together when using the tools, but also to factor in community input and insights that can provide a richness to the data that no pre-existing data source can do. So as we've heard from Mr. Wiley, our community-based partners, our community members really know best what's going on in their communities. So please layer in that, that third component when looking at these 2 indices. So now we are actually going to dive into a live demo of the tool. So I am going to share my screen in a moment. And Daniel, I'll need you to actually stop sharing first, and then I'll be able to share. All right, so here we go. So this is the Justice Equity Services Index site. So I'll first walk you through how to use and interpret the component maps. But first, when you go to the page, you'll see all the information, origin of the JESI and what you can do with it. Key findings, you'll first come across the JESI map, but we're going to go ahead and go down to the component maps to start out. So you'll see there is a separate tab for each component. So again, these are the results for every component. So you can look at each of these individually. So we're going to actually take a look at the prevention and intervention tab, which again, this includes youth development and prevention and reentry services. So I am actually going to open it in another tab, just so it's a little bit larger for you all as I'm sharing my screen. So here it is in a larger tab, and I'm now going to walk you through just how to read this map. So in this map, we see some cold spots or areas of lower service levels in parts of Southeast LA, East LA, the San Gabriel Valley, the San Fernando Valley, and parts of the Antelope Valley. Lighter yellow areas are areas with a lower level of services in the prevention and intervention component, and darker yellow areas are areas with a higher level of services in this component. So you can see, so here if I turn this off and back on, the red outlines are the ways you can identify the zip codes with the high or highest need based on our Justice Equity Need Index. And here again, we see especially clusters in Southeast LA, as well as East LA, parts of the San Gabriel Valley, the San Fernando Valley, and the Antelope Valley as well, that have low or lowest service levels, so the lighter yellow areas in this component, but higher highest need, so with the red outlines. You can also add in supervisor districts, as well as service planning areas to see how those intersect with these areas of need. You can zoom in to get a greater level of detail, and there will be more labels that will pop up so you can understand where in the county you're looking at. And then you can click on a zip code for more information. So I am going to go ahead and click on a zip code over here in Bell. So 90201 in Bell. And we're going to walk through this pop-up now. So the pop-up tells you the zip code score on the component. So 12.2, so about the 12th percentile of service levels in this component. So this means that nearly 88% of zip codes have more services in this category than this zip code, 90201. It's ranked 250 out of 277 overall on the JESI. And then if you scroll down, you'll see this statement that summarizes its overall component score on the JESI, its overall score on the JESI, as well as its scores by components. So we see it has low or lowest service levels on the rest of the components, and then a lowest overall service level on the JESI, that final part of the statement. So as you interpret the percentiles, and there's a note at the bottom here, it's important just to keep in mind that percentiles range from 0 to 100, and then with 100 indicating a highest or the highest level of services. So that is the prevention and intervention component. So we are going to go now back to the JESI page, and you scroll back up, we'll get back to the JESI map. So the overall results for the JESI. So again, the JESI is the average of the 4 components. I just opened it in a larger tab so we can look at it better. In this map, we see cold spots or areas with lower level of services in parts of Southeast LA, East LA, the San Gabriel Valley, and the Antelope Valley. Lighter purple areas, again, indicate a lower or lowest level of services, whereas the darker purple areas are higher, highest level of services. So here again, so if you put back on the red outlines, you'll see that there are some patterns between service levels and areas of need. So you see clusters of places with low or lowest services, but higher, highest need levels in Southeast LA, East LA, San Gabriel Valley, Antelope Valley. But now with that layering in, we see that there are some areas with lower, lowest service levels, but high or highest need in the San Fernando Valley, as well as parts of South LA. So again, I'll go ahead and click on a zip code and we'll walk through the pop-up. So here, zip code 91402 in Panorama City, we see that this zip code was between the 13th to 14th percentile of service levels. So slightly more than 85% of zip codes have more services overall on the JESI than this zip code. It's ranked 241 out of 277. So again, at the lower end of services. And then looking at the results by component, we do see some variation. So it has the lowest overall service level on the JESI, and then lowest or low on housing and employment, prevention and intervention, community services and advocacy, but then a moderate level on health and wellness, so slightly higher services on moderate on health and wellness. And you can see that too if you look at the percentile score. So a higher percentile score again means a higher level of services. So I'm going to go ahead and now stop my screen share so that Daniel can share the slide deck again, and we're going to go over just a few additional points as you start using the JESI on your own. So again, as you saw me go through and interpret the map, we really encourage you to understand how this tool can be used in combination with the JENI. If you aren't familiar with the JENI, you can get to know this tool and how we use it to identify communities that have been disproportionately burdened by our broken and detention-first criminal justice system. So just looking at this map of the JENI, you'll see that how many of the areas with greater need, so in the darker orange, often coincides with areas with lower service levels on the JESI. So there's a link at the bottom there where you can go and get to know more about the JENI. Next slide. So finally, just wanted to share a few key takeaways about this comprehensive tool. So we took the data that you saw on the maps and we analyzed it by region in the county. As many of the maps suggest, justice-related services do not always align with justice equity need in the county. What we found is some regions overall have lower levels of justice-related services. For example, parts of the Antelope Valley, East LA, the San Gabriel Valley, South LA, and the San Fernando Valley have large swaths of zip codes with lowest or low service levels on the JESI. And then actually the Antelope Valley, East LA, and Southeast LA have some of the lowest levels of services. Additionally, some regions have greater access to certain types of justice-related and care-first services or certain JESI components, but lower access to other types. For instance, a large portion of the Antelope Valley has low to lowest service levels on the health and wellness component compared to parts of the Antelope Valley that have high to highest service levels on the housing and employment component. Metro and West LA are actually two regions that have a large concentration of highest or high service levels across most JESI components. So those two regions are different than the others. And then some regions have a better match between services and needs. While Metro, the South Bay, and West LA see a greater share of their highest or high need JENI zip codes having highest or high JESI service levels, the Antelope Valley, East LA, the San Gabriel Valley, and the San Fernando Valley have a higher share of their highest or high need JENI zip codes with lowest or low JESI service levels. So a greater mismatch between need and services. So these vital, additionally, these vital justice-related care-first services are mostly comprised of smaller organizations with incomes less than 500,000. And then when we look at organizations that are in our highest or high-need communities, they're about the same size. They're mostly comprised of these smaller organizations as well. So this suggests that organizations in our high-need communities are not typically any larger to meet the greater need in those areas. So we really encourage you to consider these findings and the patterns that we see in the JESI and the JENI as we guide investments in our community-based system of care, because those services are so essential to addressing the needs of our communities and supporting them to thrive. And to look at those at the JESI overall and by component, layering community input and looking at for differences regionally and by zip code. And I will pass it over to Jacky now.
Thank you, Elycia, and thank you, Daniel. And so I think we have a moment for one question. So I want to answer the question that came in through the chat around the predominant language spoken by some of the providers in those high level of service areas. You know, again, like that is a really important factor, right? That unfortunately this tool, given the data source, does not capture, which is, again, that primary language spoken by that organization. That underlines that earlier point that we had made, how this tool on its own is not as helpful as it is to use this tool in partnership with community residents and community organizations on the ground to get a sense of what you know, what those services, the all-encompassing services that those organizations are offering, and also getting to this broader question around quality as well, right? That again, this tool doesn't quite get to. You know, the other important factor to note too is in some of these areas, it shows up as a high service, but again, to underline what Elycia is saying, it doesn't mean that that high level of service, if you will, is meeting the need of need in that community, right? That is also why we encourage that further investigation, interrogation, right? And that can only be done again in partnership with those folks in those communities. But this tool does at least allow us to get initial glimpse of what that capacity looks like. And just to underline again what Elycia said around looking for some of those cold spots of services, taking just multiple zip codes together and in one will let you see, okay, in that service radius, there does look like there is a need, given that there are not many organizations being located there. So again, this is just an initial starting point, because through many folks in this space, who are part of the Measure J process and other processes, before we just didn't have at least an initial glimpse of what that service capacity looked like in those communities. And this gives us an initial look at that again. So really important questions that I believe was Alan raised. So want to make sure we get to that immediately. So without seeing another question in the chat, now I actually want to pass it over to our next guest, Judge Songhai Armstead, who is the Executive Director of the Alternatives to Incarceration Initiative. Before I pass it over to her, I want to talk a little bit more about the Alternatives to Incarceration, ATI initiative. As a reminder, it was established last year, March 2020, right before the pandemic. This initiative was established following a lengthy but incredibly powerful community participatory process that took place in 2019 via the Alternatives to Incarceration Work Group. It encompassed multiple ad hoc committees where dozens of organizers, activists, and government agencies worked together to develop that roadmap with over 114 recommendations to help the county transition to that care first, jails last approach. That process culminated in the Board of Supervisors establishing the ATI initiative, housed within the CEO's office in March of last year, to, in essence, operationalize the recommendations provided by that work group. And so that is the initiative that now Judge Armstead leads. And she was appointed September of 2020 of last year. And it's kind of crazy. I mean, last year, we've all lived through that, and it feels like such a long time ago, but it really, wasn't. Before I pass it over to the judge, though, I want to read her bio, just so you can get to know her a little bit better if you have not yet heard her bio. From childhood and throughout her career, Judge Armstead has been a consistent voice advocating for truly equal justice for all, drawing upon her own history of multiple childhood traumas, including stints in the foster care system and the now closed McLaren Hall Children's Center, but also recognizing the immense opportunities and supporters in her life who stepped in to help. Judge Armstead has centered her career around building inequitable opportunities in healthy communities. It was at UCLA Law that one of her professors convinced her to become a prosecutor, telling her, if you want to make meaningful changes, he told her, you have to become a part of the system instead of fighting it from the outside. As a prosecutor and later as a judge, she has been instrumental in creating innovative programs that assist justice-involved veterans, the houseless, people with mental health, substance use, physical health, and co- and tri-occurring disorders. While with the Los Angeles County Attorney's Office, she pioneered programs for those deemed chronic offenders, giving them a chance to get treatment, find housing, and clear their records in lieu of jail time. During this time, she has also served on the LA County Mental Health Commission, and as a Superior Court judge appointed by Governor Jerry Brown in 2015, she served on the court's community outreach and mental health judiciary committees. She's also taught hundreds of judges, including the justices of California Supreme Court, attorneys, law enforcement, and social service providers on implicit bias. In addition to her regular court calendar, she held specialized mental health, gang diversion, regional center, and veteran court days, focusing on getting people the treatment and housing and resources they needed to improve their lives and break that cycle of incarceration. So again, very happy to have Judge join us this morning. Now, Judge Armstead, if you could please talk more about your first impressions of the JESI and the Jenny, how you've seen them be helpful in implementing the programs that you've been charged to implement based off of the ATI process, and then also talk a little bit more about that need to continue building the capacity building of providers who are so essential to this approach and to this transformation. So I'll pass it over to you, Judge, so you can talk a little bit more about that as well. Thank you.
Thank you. Can you all see my screen? Is it up, the maps?
Yes.
Okay. Thank you. So first of all, thank you so much for having me here. I appreciate the partnership as you know. Many of you, I've worked with you in a number of settings, but I'm so grateful for this resource. I'm so grateful to be able to really use data as a way to sort of push our agenda. Every day I'm surprised by sort of the inequities that we see throughout our system, right? I'm surprised by just the data that I found. And so when I was given the assignment, as you know, Los Angeles County is, the same as probably a small European country on most levels. And the idea of having to prioritize sort of the needs throughout the county and figuring out how to streamline sort of the work of the work group and the mission of the board and sort of the move of the county, really data was the only way that it can happen, data and really listening to our community partners. And so really using sort of the JENI and the JESI to sort of prioritize and sort of define our role has been key. So what we've done is on the map that you're looking here, we've taken sort of the JENI and overlaid it with the JESI. The other thing that we've done is we pulled county data to really look at sort of what was happening in the justice realm. And when we did that, we were able to see that there was just 8 jails that really booked 51% of all those people that were going into our justice system through an LA County. So just 8 jails did 51%. When you think about the fact that there's over 10 million people here in 88 cities, but 8 jails booked 51%, it kind of let us know where we needed to begin. And so in doing so in the ATI, we've only been here since September, and we have a very small staff, but we've already launched really looking at sort of diverting people out of custody and into housing and services at the earliest possible moment. And so right now we're sitting in 6 courthouses, really targeting the communities that show that they were in greatest need. So 1 through 6 in the green squares, we already have rapid diversion programs up and running where people are connected to housing and services in lieu of pleading to a case as a form of diversion. And then we have Compton and Pomona coming on next online. And then we've also partnered with community service providers looking at other communities to get people out in jail before cases are even filed. That's the pre-filing diversion. That's represented by the blue diamonds. We just launched 77th last Monday, which your data truly informed and the community partners truly informed that South LA, which takes all the women of LAPD and then all of the South Bureau folks. And so we launched 77th, where we have, for the first time ever in history, we actually have people with lived experience who are part of a community-based organization sitting in the jail to help divert people after LAPD does a basic screening based on qualifications from the DA and the city attorney to divert people both on misdemeanor and felonies into housing and services. And so we'll be launching the rest of these hopefully by the end of the year. Next up will be Lancaster and Long Beach, which are also areas that we saw were in great need. And then Pomona, I think, is shortly thereafter, but those are the places that were coming online. As I think was mentioned earlier, we are working on Incubation Academy, which I'm excited. We'll be starting our first cohort in September. And it's really your data that's helping us decide what areas to target to really help community-based organizations build out capacity so that we can partner with them throughout the county in a number of areas. So the first cohort will be folks just for ATI that have beds. The second cohort will be folks that can provide reentry services, a variety of reentry services, training classes, supports, case management, housing, et cetera. That should launch probably in January. And we'll be targeting the same exact areas that we've shown that there's high incarceration rates, low services there. So kind of the same clusters where you see the numbers and the letters falling on the maps will be the areas that we'll be targeting first for those Incubation Academy. And it's really helping us to really, when we go to the board and others to say, these are the areas that we need help, where we need funding, it's really the data and the voices of the community that's helping us to do that. And then I guess the other big thing just to mention, I know I just have a couple of minutes, is really the bed and service availability app that we are building. An RFI just closed, and the idea is really to show the variety of services throughout the county. So when a person is in crisis, it is not law enforcement and folks who respond, but really community who can respond and help link people to services in real time and beds in real time, using both a connection of services here, county funded services, and other resources for community. So that's the short version of the stuff that we're working on, but we really couldn't do this without all of you all as partners. So we're really grateful for the partnership and helping us to really use data, both metric data and also personal story data, so that we can move the agenda forward throughout the county.
Yeah, thank you, Judge, and thank you for showing this example of how you've been using this these tools, right? And then again, partnering and hearing from folks on the ground to inform the programs and services that you provide. If we don't mind going back to the other slide deck, please. I also just want to take a moment to answer some of the questions that have come in through the chat as well. This question around quality, is a really important one that has been lifted up by multiple folks we've spoken to, and unfortunately, these tools on their own don't provide that, right? So that's where working with a set of within a coalition or another space to be able to identify how do we begin to evaluate that quality and evaluate the quality over time, right? Especially as we start to shift towards this model. How do we assess that transformation and the impact that it's having? But at this moment, right, we're not able to get to that. What I will say though is that the tool does at least provide us an initial idea of like the names of those organizations in the community, and we'll be able to, at least provide a starting point for ways that in the future we can contact and start to provide those lists as well to individuals who may want to do that outreach and begin those conversations to begin to assess quality.
Can I speak to that?
Yes.
So just as to quality, one of the things that we're hoping to do through the Incubation Academy is to provide technical assistance and data tracking so that we'll be able to help organizations that may need more help to deliver a better level of service if that's necessary, and also to track outcomes so that will be something that communities, organizations can point to about outcomes and quality. So that's one of the things that we are working on. So we're hoping to do that in partnership with the community as well.
Thank you, Judge. And you definitely have a full plate. So again, it's going to take a village to be able to move that forward. And so, before we transition out, and I talk a little bit about the call to action, I just want to also underline, the story that we see here, right, when we look at the JENI and the JESI is really a story of disinvestment, underinvestment, and overcriminalization. Right, it's really that historical kind of calling back to what John had started off, this conversation with, is that it's been over 100 years, right, of just disinvestment and racialized disinvestment that have contributed to the communities that Mr. Wiley talked about, where you walk outside and you don't see the infrastructure, you don't have the parks. You don't have the proper schools, you don't have those supports and services that you need to thrive, right? And so now our charge, unfortunately, is to correct that, right? And to provide that investments in those communities that have been disinvested, that have been forgotten, have been systemically targeted, right? By this cursor first approach, instead of the approach that many other communities benefited from, which is like care and services and supports, right? And so that's what we're really here about. We're really here to reverse that, right? And it's going to take a lot of work on our behalf to make sure that the county continues in that step, in that transition, right? There's going to be folks that, like we've seen this lawsuit around Measure J that try to hold us back, but we know that we're gonna continue charging forward and pushing ahead to make sure that those dollars, resources, it's not just funding, right? It's the capacity building, it's the connections are being made to bring us together to be able to heal the communities that again have been disinvested, have been historically targeted by the criminalization system. And so again, just want to also, say again, I feel like it's so important we continue to say this, that these tools are really a starting point to help us evaluate that community-based system of care. That is, the tools on their own are not the solution, right? It is using that to begin those conversations with policymakers and advocates in partnership with providers and community organizations to get that grounding understanding of the needs and the quality of services, right? So it's not just them on their own, it's that partnership that makes this work. It is also very vital that we continue focusing resources to reducing the number of people encountering the incarceration system, right? So that way, and really focusing our dollars and our investments and our time and capacity and building up that system of care. And really, the county has a really critical and momentous opportunity to set that bar at a national, international level through a multiracial coalition to be able to transition away from this carceral first approach and care first model. And like I said earlier, there's going to be setbacks that may come into play, but we shouldn't let them, or they're going to be, barriers put in our way to stop us from going in that direction. But we still have to continue because it is the just and the equitable thing to do, right? So again, we very much thank you for joining us this morning. We know that it's a busy time of year with budget season, so we're very grateful for those of you who were able to stay with us. Like I shared earlier, the webinar recording will be shared, the slides. We also have a one sheet, and of course the links to the JESI and Jenny will be sent out to folks who registered to this presentation. We know that there's a lot of information that folks are still sitting with, so you may have more questions, or you may want a deeper conversation and understanding. So in the slide, you can see how you can reach out to us. You can reach out to the Advancement Project if you want more details about the JESI and Jenny. You can send an email to eci@advancedproj.org, and we'll connect you with the research team or our team that worked with them. You can also reach out to Yusef-Andrew if you would like to hear more about his work and the services he provides. And of course, you can reach out to Judge Armstead and her team through the ATI initiative email there. We can't thank you enough. The work you're doing is incredible and it's so important. So just super appreciative of the time you took with us this morning to hear more about this tool. Thank you so much.